Okay, so this lesson's on the cognitive approach to treating a depression. We're going to be looking at cognitive behaviour therapy, which includes several different therapies. So, first one, CBT. This is the most commonly used psychological treatment for depression. It begins with an assessment for which the patient and the therapist work together, talk about the person's problems, perhaps give them a little bit of homework. And they identify the goals for therapy and put a plan together, how they're going to make that person feel better, how they're going to remove faulty thinking. So one of the central tasks is to identify this faulty thinking and those irrational thoughts, and then they'll think about how they can challenge those thoughts and feelings. So it's basically trying to extinguish those negative thoughts and feelings and put more effective behaviours into place, or teach people how to deal with those negative thoughts and feelings when they come into place. Some CBT therapists are using techniques from Beck's cognitive therapy, or some rely exclusively on Ellis's irrational emotive behaviour, whereas some use a bit of both. There have been some new techniques brought out as well, like mindfulness training. Hopefully I'll be able to give you a bit more information on that. But there is always advances in psychology, certainly in the area of cognitive behaviour therapy. So let's just check out Beck's cognitive therapy. His idea is to identify the autonomic thoughts about the world, the self and the future. So the therapist will sit down and they'll ask the person how they feel about their self, what their worries are, thoughts are about the future, how do you feel about the world. Once they've kind of got that triad of thoughts, they will start to challenge these thoughts and feelings. This is central to the theory, this idea of challenging them, basically trying to say, prove to me why you are right, why your thoughts are right, give me some evidence for it. So, for example, they'll be given homework, such as recording when they enjoyed an event, or when I've just seen a typo, when people were nice to them. In the future, when a patient's saying that no one is nice to them, or there is no point at going to the events, and the therapist can produce this evidence and use it to prove to the patient that statements are incorrect. So basically, the person goes away and they're asked to sort of log and find their own challenges to their own thoughts. Therefore, in the future, when they come across a thought or a feeling and are thinking, oh no, I can't do this, I'm really bad, they can go, hold on a minute, what happened to me the last time when I was in this situation? It wasn't as bad as I thought it was going to be. So let's have a look at REBT. This is extending the ABC model to an ABCDE model. D stands for dispute and E for effect. All right. So basically, the key to this technique is identifying what those beliefs are that cause the consequences of these behaviours. For example, a patient might talk about how unlucky they have been or how unfair things seem, and an REBT therapist would identify these examples of a utopianism, life is always meant to be fair, and challenge this as the rational belief. Well, life isn't always going to be fair and bad things do happen. This would involve some sort of vigorous argument, disputing of the belief, and the intended effect is to change the irrational belief and break that link between the irrational belief and feeling depressed. There's two different phrases of disputing. In fact, actual fact there's three, but your textbook's only telling you two at the moment. That's empirical disputing or empirical argument, involves disputing whether there is an actual evidence, physical evidence. Where's the evidence to show me that your negative belief is actually true? And your logical argument involves disputing whether negative thoughts logically follow from the facts. Okay, so would it logically follow that just because you failed in the math test that you are never going to get a job? No, that's not a logical argument, right? And plus, there's no evidence for it. So they will challenge these thoughts through these types of methods of disputing. And also, therapists will uncover behavioural activation. There's lots and lots of evidence to suggest that being more active and engaging in enjoyable activities and removing your focus from the thought patterns will actually help you reduce those negative and irrational thoughts that you're going through. So What about CBT? Is it any good? Well, yes, it is actually very, very effective. March et al. 2007 compared the effects of CBT with antidepressants and found that CBT was just as effective as antidepressants. They also found that antidepressants with CBT was more effective than either of them alone. Generally, the antidepressants are given make the person feel a lot better in the short term, and then that allows them to focus and do the hard work, which is the CBT. CBT may not work for the most severe cases, and because it is hard work. It is like going to a session and coming away and having some sort of homework. So it can't always be the sole treatment for depression. And also, as with any relationship, the success of a relationship is always based on how the actual people get on together. And if a person's paired with a therapist that they don't feel comfortable with, then the therapy just isn't going to work. And also, as if you remember when we were listening to Stephen Fry, he said about it was just the opportunity for having to talk to somebody. And Labroxy reckons that perhaps that's what it is in terms of CBT, and it's not actually the methods that are used. Other problem is it really does overemphasize cognition and the thoughts that are causing depression. It doesn't take into account the fact that someone might be living in absolute extreme poverty. Well, they're going to be depressed, they're going to feel down, they're going to feel sad if that's the case. So we do have to take those sort of things into consideration. Okay, see you later.